I had an issue when it came to it being online because I didn't really know where to look, and it's so awkward. It's so awkward in the beginning online because it's not the same as in person. Like online is like you don't know where to look at the camera screen, you don't know where to look at the person. And with Imperial software, I found out when I was practicing for interview, they gave us like a link beforehand to like practice their software, and it was really weird because it looked like I was looking the complete other direction when I was actually looking at the camera. That was something that, was a bit weird. What I would say is beforehand, if whatever, if you're going to use your laptop and, turn on the camera and try to practice like that, like stimulate what a real life online interview scenario is going to look like, if that makes sense, and look back to see if everything does look a bit okay. If people are struggling with, for example, eye contact, or like they're struggling with their confidence in speaking, um, it's literally practice because um like what you need to keep in mind is that then you just need to hit points that they want to hit. It's literally that there's specific things that they do want to hear, and they're waiting to hear that. And the more you practice, the more confident you'll get. It needs to become to a point that when you hear a question, your brain automatically goes, so they're talking about skills. So this is the skill that I need to mention, and I need to link it to medicine this way, and I need to like talk about this experience. The more you practice questions, the more easy it becomes to pick up on these certain things. It's about practice. It really is. With practice, you get better because you're repeating, the same things again. In the beginning, it might be a bit difficult for you to answer a certain question. Definitely was for me. It would take me like more than 5 minutes to answer. Like, for example, a junior Dr. Strike's question. I found it very difficult in the beginning, and I'd stutter a lot, and I'd always like go back and like take back what I said. But with like practice, sending, voice messages to myself, for example, talking with ChatGPT, all these things, I got better and better and better because I just did it again and again and again. And really, practice does make perfect. Like you need to repeat. And when you do rinse and repeat this, even if they do throw a question that's a little bit weird and it's a bit tricky to extract what exactly they're saying, you will have like a vague idea going on because of all the practice that you've had before, if that makes sense. With how often you should practice, just do little and often. So one thing that you could do is you could follow, the website that Oja showed earlier with all those dates and those topics. You can literally write it on that. You can literally do that topic on that date at that time, if that makes sense. That could be like a really good like routine for you to follow. If that doesn't work with you, um, do something else. It's literally not just doing a little bit every day. Um, I can't tell you exactly how many hours to do. You don't need to do like you don't need to like go head fast in the beginning, like do like 5 hours a day. That's not necessary, but it's about doing what works for you. Like what works for me might not be the same as what works for somebody else, and somebody else might pick up the skills a lot faster and may not need to do it as much, if that makes sense. But so I can't tell you the amount of hours, but I could tell you what things you need to learn. Does that make sense?
I think that makes a lot of sense. And I guess it
Okay.
really depends person to person, as in when they're
Yeah.
starting, how long they've done it for, how much
Mhm.
background knowledge they have. I mean,
Mhm.
in terms of actively answering questions, if you're doing more than an hour or so a day of talking, you're probably going to get exhausted. So that kind of practice probably minimal. But if you're enjoying it and you're reading about interview topics online, then really as much as you can. It probably depends on how much else you've got going on at home, so many other things. But yeah, definitely try and spread it out. Avoid panicking, avoid leaving it last minute, and you should be good. So thank you so much for the advice. And if we make a start with some questions, let's reopen the chat. I just closed the chat so they didn't spam hundreds of questions. So if they put a thank you in the chat for all the advice, now that I've reopened it. Brilliant. Thank you so much. If we now move on to some interview style questions then. And just to confirm, the students are answering the questions rather than you for the MMI bit. And then for the
Okay.
Oxbridge bit, we have volunteers. So, yeah.
Great.
Now, before we start, why do you want
Everybody
to
have a
study
good day.
medicine? So,
Thank you.
oh, you're welcome. Thank you for coming. So if we think about the different sorts of questions that we can get, MMI style questions, or even kind of the more traditional panel ones that are not Oxbridge, like Queen Mary, Southampton, and like for example, Glasgow, these interviews are all going to be focusing on these kind of topics we have here. So we have personal attributes, motivations for medicine and dentistry, like why medicine, why this uni, hot topics, like things that are happening in the news right now, what's going on. So, for example, when there were the resident doctor strikes, talking about that sort of thing, more broader kind of everlasting problems like pay crisis, like recruitment and retention problems, like aging population, mental health crisis, obesity, these sorts of things. So the kind of stuff that's going on with the NHS. You got role play questions, which can be like break bad news to someone, or communication. You can have kind of direct communication skills questions that are a bit abstract, like explain to someone how you would tie a shoelace, give step-by-step instructions. You got situational judgment questions, and they're generally very common. So things like how you would deal with, for example, a patient giving you a gift, what would you do? Someone is cheating on an exam, how do you respond? Just like in the UCAT. And you've also got ethical debates that require you to deal with different ethical scenarios. So things like, for example, assisted dying and euthanasia. And in terms of if I think the removal of NHS England will be a hot topic, I think it potentially could be. I don't think there's necessarily that much to say about it. And I don't think necessarily year 13s are the right audience. So I would certainly revise it. I would prepare for it. But I don't think it's necessarily the biggest hot topic. I think probably as assisted dying is still ongoing and the assisted dying bill is currently remains in the news, is being debated, I think that's probably the bigger one. But NHS England is definitely a reasonable thing to think about. So if we start by going through some questions, and I'm going to close the chat for irrelevant ones for now, so I can focus on the people giving the answers and make sure I give good feedback. So we're going to start with one about why do you want to study medicine? And so for these questions, we shouldn't necessarily need to ask stuff in the chat. When we get onto the Q&A, we'll go back. So have we got any volunteers for why do you want to study medicine? Zainab, if you'd like to give it a go whenever you're ready.
Um, I would like to study medicine due to a interest in the methods used to treat people, patients, especially in the public health sector and more specialized care. Do I talk about what I meant to do as well, like what I've done in this question?
Yeah, for sure. So you have to reflect on your
Okay, yeah,
experiences. Why
yeah.
did it make you want to study?
Okay. I last year I did an EPQ, which was based on public attitudes to vaccinations and how different people may oppose them for different reasons. This EPQ experience really opened my eyes to medicine, as it made me think about different types of treatment to a minor extent, and especially how such not following such guidelines may harm society, or why they might even choose to not do it in the first place. Since then, I've been looking more into different types of treatment and the applications in medicine, such as medicinal plants and toxins, like how toxic plants can be used for treatment. And I've also been looking at new methods of medical treatment as well, such as vaccinations, cancer vaccines. Yeah, this was improvised, so
Right.
sorry.
Should
It's not
I
very
start
good.
giving some feedback or?
Yeah, sorry, it wasn't very good. It was
No,
improvised.
no, no worries at all. At this stage, we're just trying it out, and that's really brave of you to give it a go. So don't worry at all. I think you've definitely made some good points. I would just think about how you link it together and how you structure it. So the stuff you've mentioned is not necessarily a problem at all. I would definitely start with some kind of reason that you can then develop. So don't mention one reason to start with and then leave it and then start on something else. Start with one kind of reason that is for you. So you can say, for example, my interest in medicine began because I was really passionate about kind of how the human body works from an early age. And I loved reading about kind of the different bones and the organs. And because I wanted to find out more, that encouraged me to do XYZ. Or you could say my interest in medicine began because when I was younger, I was unwell, I was in the hospital, the doctor was a great communicator, it did XYZ for me, so on. So start with a reason, it doesn't matter what, or you can say I read this really cool book and it was interesting for me because XYZ, and that led me to go on and do something else. And at that point, it would be a great idea to talk about your EPQ, but make sure you're using that specifically to answer the question. So the thing
Okay.
you mentioned about the importance of vaccinations was completely fine, but then you want to link it back to why you want to study medicine. So why
Oh,
does your research into vaccinations make you want to study medicine? Is it because of the potential for public health to save so many lives and make such a big difference for people? And that's something that you would like to do. Or when you talk about the different types of treatment and how that interests you, is it because kind of you heard about a specific form of treatment and you've been reading about the research taking place for that, and you personally really enjoy the research side of medicine and you would love to be involved in innovating and kind of finding new discoveries, finding new treatments?
okay,
So make
thank
sure
you.
if you make any points, it's always linked back to why you want to study medicine.
Thank you. Well,
Does that make sense? So all this stuff is good. Just make
yeah.
sure it's always related back to the question. But thank you so much for giving it a go. Right, let's have Alishba. Why do you want to study medicine?
Hi, I want to study medicine because, well, it started off because like I wanted to really help people get better lives, like improve their quality of life. But recently it's developed more into the fact that I want to help lessen waiting times in the NHS because I've recently been getting into like keeping up to date with the news on the NHS, and I find it appalling that so many people aren't being treated because of all the waiting lists and things. So yeah.
Amazing. Thank you so much. So I think the answer definitely started off great. So you have a desire to help people, but just make sure when you mention something like that, you don't just abandon your point. So the whole idea here is all about reflection, bringing in examples from your personal experience, bringing in examples from what you've done and relating it back to why medicine is for you. So if you say, I would like to help people, talk about that more. How specifically do doctors help people? So can you give an example of maybe something you've seen in work experience? Like today, you heard an oncology talk. How do doctors help people in that setting? Did you see anything in the work experience talk? Did you hear about what a big difference they make? Did that then inspire you that you want to go on and treat patients and support people in the same way? So when you say you want to help others, make sure you qualify it. Then that's totally fine. You also said that initially I want to help people and now I want to do something else. Don't say that. Say that initially I want to help people. And in addition, I've also found out about XYZ. So don't say that I don't want to help people anymore. I'm sure that's not what you meant. In terms of discussing help the NHS, I think maybe you can mention that, but I probably wouldn't put it as your second point. When they're asking you why you want to study medicine, the main thing in this question is to be reflecting on your understanding of the medical profession, the kind of things that the job of a doctor involves, and relating it back to your own skills, quality, and experience. So helping the NHS is kind of, it's a really good idea. And I would say it maybe towards the end of your answer that I know the NHS is under a lot of pressure and I would love to make a difference, but it wouldn't be the main points. So the main point should really relate to what you know the role of a doctor is like and what it involves. So think about the different aspects of a medical career. You're helping people celebrate some of the happiest moments. Things like when in oncology a patient is treated for their cancer. Things like when a child is born. Things like when someone has a broken hip and you're able to repair it and restore their quality of life. But you're also there at some of the saddest moments. For example, in something like palliative care, where patients are at the end of their life. And in both cases, you're making such a huge difference because when someone is at the end of their life, and if you're able to make them even a little bit more comfortable, that is such a big difference for them. So there's sad moments and they're happy moments, and yet you would find them both really rewarding. And talk more about the aspects of a clinical career. So you're kind of lifelong learning. You are meeting with people from all different walks of life. You're interacting with them on a daily basis, and you love communication, and you can give an example of that. You can talk about teamwork and how you love working in a team and how doctors work in a multidisciplinary team. So that really suits you as a career. So talk about the clinical side of medicine. Then talk a bit about maybe the academic side of medicine. Are you interested in research? Are there any books that you read? How does that relate? And maybe talk about other things as well. So things like teaching as a doctor, things like portfolio careers. You might want to go overseas and volunteer, all these kind of things. So clinical, academic, personal aspects, even like leadership, teaching, that aspect.
Thank you.
You're very welcome, but great answer. Thank you for being brave. Let's have John, if you give it a go with that advice in mind.
All right. Uh, I've always been fascinated with science, even from a young age, because I found that it gave an explanation for things like you wouldn't think about otherwise. And then as we went through school and like biology got more complicated and it was less simplified, I found it more interesting because there was less, shortcuts around it and we were being told the actual facts. And then after we do something at school, like I found it really interesting. So I'd go and try and research a bit more about it. Like even if they said, oh, you don't need to know about this bit for your specification, I might go and have a look about it to just get some more knowledge. And then look around the careers that I could do with biology and chemistry. I found out about medicine. So then I looked around and I looked at, how hard the career could be because you have to balance your work and your normal social life because otherwise you won't be able to become a good doctor and care for the people. So we had a work experience week in February. So I got an opportunity to shadow a GP and I found it to be very interesting because I got to see a wide variety of people, and like every interaction was different. And when you interacted with them, like some people, for example, I watched a couple of, routine blood tests, and like some people, they didn't care about the needle. They were like, oh, it's blood. They didn't want to look away. Like they didn't really care. But other people, they were scared, and I could see how the nurse reassured them when they took their blood draw. And yeah, and I even saw one where the blood, like the person who came to collect the blood, they come and collect it at 12 every day. But there was a delay with one of the patients because like blood wouldn't come out of their arm. And then it caused a knock-on effect. And the blood courier was waiting. And I could see like the stress that the nurses, the multidisciplinary team had to handle and like how they had to coordinate it. Like the nurse made me sit, they told me to go tell the blood courier to wait. And I found it quite interesting because it showed that, okay, you might learn like the science behind being a doctor, but when you actually go experience it, like it'll be very different to your studies. So that's motivated me a bit more now to study medicine. So yeah.
Amazing. Thank you so much, John. So, if we think about some feedback for that, I mean, firstly, it's a very kind of well-developed answer, and you clearly took on my feedback of kind of starting with an initial point. And I really like how you started. So, kind of always fascinated by science, that's where you want to begin. And you were curious about the human body, you were inquisitive, and you had an inquiring mind. That's what they're looking for. You might want to use some words like you can say evidence-based medicine. So the modern practice of medicine deals with facts, deals with evidence, deals with research, and you really like that side of things. And you like to understand the how and why in depth. And that's why the medical degree appeals to you because you got 5 or 6 years of in depth study of the workings of the human body. So make sure you're very specific about why medicine has that. You're spending 5 or 6 years, but also lifelong learning. So throughout, we had the doctor say earlier today, 35 years old, still doing exams, still learning. So relate that back to medicine, but perfect. What you said was great about inquiring mind. Then you moved on to I had a work experience week, and there was a little bit of talking about less relevant stuff until you got onto the GP. So no need to say I had a work experience week, and in that work experience week I saw a GP. No, just go straight to that. So mention I was lucky to do a GP work experience, and don't make it seem passive. I had a work experience week seems like somebody got you to do it. Say I was
Oh,
fortunate enough to shadow a GP, and while shadowing a GP, I was able to see the variety of different cases, the experiences. Brilliant. I would be a bit more specific at that point. So, really, really good that you've mentioned it. But talk more about the different roles of a GP. So, what does a GP do? They might treat kind of minor illnesses that come into the GP practice on a day to day basis. but also they're managing an ongoing caseload. So they have kind of patients in the community who might have been discharged by hospitals. They might have ongoing illnesses and concerns like cardiovascular disease, like diabetes, and the GP is responsible for managing that over time. So you definitely want to address what does a GP do? They're kind of one-off patients who might need referrals to a secondary care. You might have kind of minor illnesses that they treat themselves. They might be doing kind of managing patients in the community who have ongoing illnesses, something like diabetes, and they're checking in with them, managing over time. So, all about what a GP does. Make sure you recognize that there are different people in a GP surgery too. So, you did talk about that later, actually, but you could from the start say that they work as a team and you don't just have a GP, you might also have nurse practitioners, you might also have healthcare assistants, other people there as well. So don't fall into the trap of thinking it's just a GP and a receptionist. You've got lots of other healthcare professionals too. So reflect on the GP stuff a bit more and also talk about public health and prevention. So you can say that you know primary care is so important because they're the first point of access to the community. That's the first place that any patient goes. And the majority of care happens in general practice. And you think that's really important because of the prevention side of things. As a GP, you're able to form a connection with patients over time. So while in a hospital, you might see a patient once and then they go, as a GP, you're able to establish a connection. And so you're speaking with them kind of on a day-to-day basis. They come regularly for appointments. You might know the whole family. And for you, perhaps building that rapport would really appeal. So you could talk to that side as well. And what I maybe wouldn't talk about is when you started to go with the story about the blood test being taken and the blood's not being transferred and the nurse had to wait. Don't start telling a story. In one sentence, if you were to say that there were some organizational concerns and it did waste some of the doctor's time, then you could acknowledge that there are aspects of the GP's life that are tricky. But that's not really the most important thing to reflect on, the telling the story about the blood waiting. There would be much better things to reflect on, like if you had an example of a consultation where a patient was quite frightened, or the GP had to break bad news. Maybe think about how they did it. How did that work? Or if there was an example of something preventative, like a GP trying to help a patient with stopping smoking. That kind of thing would probably be better. I wouldn't necessarily tell a story. I would more focus on the reflection side.
All
But I
right, yeah,
mean,
that
for
makes
this
sense.
stage, really, really impressive answer. And you definitely have the right structure. So it's just filling in the fine details of what bits you're reflecting on. So really good.
All right, thank you.
You're welcome. So if in terms of what a model answer might look like, how you would structure it, what my suggestion would be, structure your answer about the roles and responsibilities of a doctor. Start with an initial driver, just like John did. So it could be an interest in science, it could be a book, it could be talking to a doctor. Maybe you got someone who's unwell in the family. That's where you start. You then talk about kind of the clinical side of medicine. So, examples from your work experience, helping patients in different scenarios, talking with all kinds of people, varied career, working as a team, link it back to yourself. So, why are you a good communicator? Why are you a good team player? So on. Talk about how there are downsides too. So stuff like you can't save every life. You could relate that to our work experience today, like we heard about oncology and the idea of iatrogenesis. So that's when the intervention that you do, the treatment actually causes patients harm, like side effects. Then talk about the research side of medicine, how it's always changing, you're always learning. And if you're answering a question, say about medicine at King's, what I always like to do is then, okay, let's think about some research at King's. And you can say, well, I heard that there's been this fantastic research happening at King's College. And as a medical student, I would love to learn more about that and get involved if possible. So if you talk about the research side, be specific and even link it back to that university if you can. And finally, think about kind of the managerial side. So doctors are involved in leadership, teaching, and link it back to yourself. If you like to tutor or if you like to lead, you're the sports team captain, you can always link that back. And then you conclude that you know medicine is tricky, give some examples of why, like it's not that rewarding, all the stuff that we heard from Dr. Watson, it's not necessarily the highest paid, yet because of these reasons, it's still the career for me. That's how you want to structure it. So we've got this acronym CAMP, clinical, academic, managerial, and also like personal stuff. So personal could be the things that you specifically are interested in. And that could be like we heard the doctor went and volunteered in a low income country. He volunteered in Malawi. So that would be stuff that's very personal to him. That would be what a portfolio career looks like. So does that make sense? I will briefly reopen the chat. Are we happy with how to structure that answer? Yeah, okay. And here are some buzzwords that you might want to use. So we've got stuff like lifelong learning, talking about your work experience, multidisciplinary team, breadth and depth of knowledge, its variety. You've got lots of opportunities for research, lots of opportunities for teaching. Now, have we got any dental applicants left? We got some dental here. Okay, so for dental, think about a lot of the stuff that I've said before still applies. So stuff like varied, stuff like the communication skills, making a difference. But there's some things that are quite unique to dentistry. So one aspect of it is definitely the consistency. So you're seeing patients regularly for ongoing checkups, where that's not necessarily the case for a GP. And if your patients are completely healthy as a GP, you might not be seeing them for 2, 3, 4 years. As a dentist, you tend to see your patients very regularly. You're able to develop that relationship, that rapport. And in most medical careers, there's not that at all. So, like as a hospital doctor, you're not seeing any kind of consistency. That's kind of a difference. There's a lot more freedom career-wise. So you can work in the NHS, you can work in private practice. If you're entrepreneurial, you can mention how that side of dentistry appeals to you. There's the whole manual dexterity side of things. So even though in medicine you've got surgery, for dentistry you focus on fine motor skills from very early on, including at dental school and as a graduate dentist from day one. Whereas as a doctor, you don't get to, if you're going into surgery, start surgery until kind of well into your medical training. And certainly there's nothing hands-on surgical wise at medical school. So that's the side that might appeal to you if you're interested in manual dexterity. And then you could relate that back to your hobbies. Like, are you an artist? Do you like making models? Anything really you could talk about there. Then think about any reasons that are more personal to you to start your answer. So, do you have a story about what is the importance of oral health for you? Have you heard about for you or for a friend how improving their teeth, getting braces, how did that improve their confidence? How did that change things for them? How did kind of improving tooth hygiene, if somebody had like whitening of their teeth, how did that improve their confidence? That sort of thing. Talk about how dentistry relates to the whole body. And you can definitely do research into this. It would be a really cool research essay. If you looked at how gum health can influence stuff like dementia, heart disease, diabetes. So dentistry is not just about the teeth. Protecting someone's oral health helps them all the way through. And dentists also do stuff like spotting oral cancer. So I remember one of our graduate students 2 or 1 years ago, they had a work experience opportunity and the dentist spotted an oral cancer. And they were able to reflect on that and say kind of how it could save lives. Also, you can talk about how the prevention appeals to you. So stuff like encouraging patients to stop smoking, stuff like encouraging patients to improve their hygiene. So you like the prevention. And you can finally give a personal example how, like, as a child, maybe you were frightened and you came across a good communicator and he really made a difference for you. And kind of that's why you want to follow in those steps. So you can start with something personal like this and then talk about the nature of the career where you get to balance the science with the variety, the entrepreneurial, and the manual dexterity. Now we've got part two. So, why medicine and not nursing? This is a reasonably tricky question, but one that they do quite like to ask as a follow-up, some interviewers. So, do we have any volunteers for why medicine and not nursing? Are you mind? Yeah, let's give that a go.
Hi, thanks for picking me. Um, so I'd say as a nurse or another healthcare professional, you are involved certainly with helping patients. It's part of medicine. It's a good career path, but you don't get that kind of satisfaction from being one of the main reasons why someone gets better from an illness. Uh, a cancer patient or someone who's is really ill, they can be soothed or helped by a nurse, but a doctor oftentimes is the person that can make the difference. And I mean, that for me is quite compelling. So that's why I wouldn't necessarily want to be a nurse, and I tend to become a doctor.
Let's think about feedback for that. So, starting by saying that doctors help patients is fine. That's really good. But you have to acknowledge that nurses help patients too. Now, I definitely understand what you were getting at, but when you said a doctor can make a difference and a nurse can't make a difference or can't make as much of a difference, be very, very careful with that. So, um, kind of for a lot of patients, the nurses are the ones who are providing day-to-day care on the ward. They are the ones who might be administering the medications. They are the ones who are the patients are seeing more often. They are running the ward, and the doctors might only be there for a couple minutes each day per patient. So you can't necessarily say that doctors can't make a difference or that nurses can't make a difference. What you want to say is how they're different. So be very specific about what a doctor can do that is a big part of the medical career and not necessarily as big a part of the nursing career. So you could say, for example, prescribing medications, making a differential diagnosis. These are things that are part of the medical career. And while there are some nurses who are able to prescribe, it's not necessarily the biggest aspect of that career. So talk about differences. Don't necessarily say that a nurse can make a difference as a doctor can't. And you'll actually find that some medical schools will have nurses on the interview panel. So keep that in mind. But really nice. Thank you for giving it a go. Let's have go here, give it a try.
Okay. So both doctors and nurses play a crucial role in healthcare. I have a great respect for both professions, but I want to be a doctor because I'm drawn to the leadership, the problem solving, and the long-term impact on the patient's life that comes with this role. Doctors take on a more direct role within the team, leading patient management while also having teamwork with other healthcare professionals. Through my experiences, in my work experience, I saw firsthand how doctors are responsible for diagnosing conditions, developing plans, and making complex clinical decisions. I am particularly motivated by the idea of medicine and its scientific knowledge because of my interest in the human body for a long time. While nurses do have deep expertise in science, it's not as complex as a doctor. And I believe for me, I'm more suited to be a doctor. And another reason why I want to be a doctor over a nurse is because of my interest in surgery. And by becoming a doctor, I'm able to pursue surgery while as a nurse, I cannot.
Brilliant. I think there's some very good points covered there. The scientific, I would definitely stick with. Interested in surgery as a specialty definitely would be good as well. For leadership, be very careful. You started talking about teamwork. Now, clearly, nurses also work as part of a team. And even in some cases, nurses have leadership roles. So you quite often have nurse managers, nurses running wards. But the key thing that you did say that was very good is making a management plan. So doctors are responsible for making care management plans for patients. So that was really nice. On the whole, great answer. Some really good points about leadership, about kind of scientific aspects, and about surgery. Maybe have a little think about the delivery in terms of how you could perhaps vary the pace you communicate at, the tone, emphasize certain words, the rate that you're speaking at. Although a big part of that is kind of facing the camera as well. So if you were practicing and it's not in front of hundreds of people, perhaps that would be a little bit different. But definitely think about delivery as well. But the points you made, I think, were all really strong. Just be very careful. If you say something that nurses can do as well, make sure you're specific about what you mean. So the best way I would start a question like this is begin by saying, actually, I have considered nursing. And I think that nursing is also a brilliant career. Nurses help lots of people. But for me personally, having looked at both careers, I think there's certain aspects of the medical career that appeal more to me personally. Now, I would definitely start with the more science, but I would be very specific about what I mean with the more science. So I would say you're covering kind of anatomy, physiology, biochemistry in a lot more depth because you're at medical school for a much longer period of time, 5 or 6 years, whereas the nursing degree is much shorter and doesn't necessarily have these focus on these basic sciences. Now, the nursing degree does focus on other stuff more, things like, say, communication skills, bedside manner, that kind of thing at times. So it's not necessarily that they don't learn as much, it's just that there might be a bigger focus on kind of basic sciences in medicine. and that appeals to you, related back to yourself. Surgery, great point. Research would also be worthwhile mentioning, especially if at your university they make you do a research project as part of the degree. So, for example, Imperial, UCL, Oxford, Cambridge, they all make you intercalate. And if you're doing that intercalation, it means that research is kind of a big part of your degree. And if you say that kind of, I'm interested in a 5-year degree where I have opportunities to participate in research, and while I know that nurses can also do research, it's not necessarily as big a part of the training process. And also, you want to talk about kind of making a diagnosis, making a management plan, prescribing medications. And again, there are some nurses that can some extent prescribe. There is a nurse prescriber role, but it's definitely not the biggest aspect of the career in the way that it might be for doctors. So these would be the 4 things to go for. Training pathway, specialization, research, making a diagnosis. Leadership, I would be a little bit more careful about. While it's true that doctors generally lead on care management, it's not necessarily the case that they lead everywhere. So if you were to say leadership, be very careful about what you say in relation to. Okay, I think we'll move on from personal questions, but we also have kind of lots of different questions about skills and attributes. So we've got ones about give an example of communication, leadership, teamwork, resilience, empathy, compassion, changing someone's mind, greatest strength, greatest weakness, biggest failure. You definitely want to have a think about examples for some of these based on when you volunteer, when you do your work experience. And the way that you would want to structure this sort of question would be like, what actually does that skill mean? Why is that skill important as a doctor? You can talk about that. Give an example of a scenario where you demonstrated that skill. So a specific example of where you demonstrated good communication. How specifically you were able to demonstrate good communication. What was the outcome of that? So, were you able to reassure someone who was frightened? Were you able to share information really efficiently? Were you maybe a tutor and you were tutoring some young children voluntarily and they weren't understanding, but you changed the way that you spoke and they finally grasped the topic? And finally, you want to reflect on exactly what was the outcome. So, what was good? What was not so good? What might you change? Is there anything that you're inspired to do in the future? So this kind of situation, task, action, result, reflecting, linking it back to medicine. And so you could get questions like this for communication, leadership, teamwork. But I'm going to move on from this area for now because we've talked about the personal questions quite a bit. And I'm now going to move on to a slightly different question that is assessing your communication skills. So I'm going to take another volunteer for this one. And what we're going to be thinking about here is that I have been blind since birth. This is a role play sort of scenario. It's assessing your communication skills. And over the course of the next 2 minutes, you want to explain the picture to me, have a discussion with me about what is in the picture. Now, do we have any volunteers that are keen to give this a go? Shravan, happy to go with you. So I will show you the picture, give you a little while, about 30 seconds to interpret it, understand it. And this is actually a question that had been used by a university in their kind of demonstration mock interview. So it is quite realistic. So whenever you're ready, I'll start your 2 minutes. So reminder, what is the scenario?
What exactly was the question? Let me just see that first.
I'll show you again. You need to explain the picture to me. I have been blind since birth, and I want to basically assess you on your communication skills, how you are telling me about the picture, and expect me to ask you some questions.
Okay.
So whenever you're ready.
So the picture, in summary, seems to be a background of a city. The main attraction is a Ferris wheel in the center. At the bottom of a picture, there appears to be a couple of boats. There's one speedboat, and there seems to be another place which hosts this Ferris wheel. And then there is one building to the right of this Ferris wheel and one building to the left. The buildings don't seem to go that high when you look at I understand you may not necessarily be able to see this, but if you look at the picture in terms of its height, the buildings don't go up to half the height of the picture, and the rest of the background is just blue sky, besides the river
Interesting.
at the bottom.
So we've got some buildings and we've got a Ferris wheel. And what does a Ferris wheel look like?
Think about the wheels on a tire. Think about the wheels of a car. So you have your main point in the center. You have your perimeter of the Ferris wheel, which is essentially like your tire. And then you have the strings which are attached to the Ferris wheel, well, they're cables in this case. Each Ferris wheel, there'll be multiple different cable cars on this Ferris wheel, where people start at the bottom, they go into this Ferris wheel. There'll be a man behind the controls, and then he pulls a few switches, and this Ferris wheel, like the wheels of a car, starts rotating. So the cable cars go up, they rotate up, and then they rotate back down.
That sounds really interesting. And so do you think lots of people go and visit this place?
Yes, lots of people tend to go and visit Ferris wheels. It's a very big tourist attraction. An example of this would be the London Eye.
Do you think it's for me? Do you think I would enjoy it?
Well, let me ask you this question. If you're comfortable with saying, are you afraid of heights?
No, I'm not too afraid of heights. Yeah, I'm quite happy with heights.
Yeah, well, if you're happy with heights, then I thoroughly recommend you have a go at a Ferris wheel because it would allow you to see the skyline of a city. If you're not able, let's say if you're going on vacation and you don't necessarily have a long time to go and visit every street and every corner of a city, if you want to see the skyline, go on a Ferris wheel. You'll end up being able to see the whole view. You're
I
not
see,
necessarily able to see.
but
Oh
I'm
yeah,
blind,
I
unfortunately,
know.
so that
I
might
did.
be a little bit difficult.
Yeah, I did forget that. My bad.
No worries.
But
We've got to the end of the
it's
end of the 2 minutes. I'll ask you one more question, as I usually ask that as well. You mentioned that the sky was blue. Now, I don't really understand what blue means. A lot of people have mentioned it to me. How would you describe it to me? What is blue like?
blue. It's the color you tend to associate with water, with earth. It's that kind of color which sort of, if you want it in advanced terms, it has a short wavelength when you look at it on the spectrum of colors. But if you want it in simple terms, think about it when you feel the sea. Sea has that very serene color. It's very pure.
So
It's
it's like
just
a
endless
calm,
and
peaceful sort of thing, is it?
yeah, calm, peaceful. It's endless. It's vast. That's what I feel the color blue means to me.
That's really helpful. Thank you. Okay, so if we end the role play and we think about some feedback. So, what do you think this question is assessing? What kind of stuff are we looking for?
Can you break it down into simple terms?
Yeah. So, are you a good communicator? How do you
Which
cope with, obviously, you've not practiced this. This is not a question you'll have come across before. So, how do you cope on the spot? Are you a good communicator? So, communication, but equally, a really big part of this is we're assessing empathy. So this patient has been blind since birth. You need to think about this from an empathetic perspective. And asking me or talking to me about the skyline and the view may not necessarily be what we're looking for. So, in terms of your description, I think that was pretty good. You covered the city in detail, the buildings, the speedboats. Maybe don't miss out anything. So, talk about the trees as well and the grass, but that was quite good. I wouldn't necessarily assume knowledge of anything. So I wouldn't speak in a patronizing way, but I would potentially ask, have you ever seen a Ferris wheel before? Just before you say that. Always check understanding, just like a doctor would check understanding for a patient. I think you responded quite well when I asked you to describe blue to me. You talked about emotions and messages, which was good. Maybe ask me what I know already. So again, when you're giving patients information, check their existing understanding. So,
mm,
kind of, what do I know already? Think about that sort of thing. When I'm going to ask you the question, do you think I would enjoy it? you really need to think about what are the different aspects of that that could appeal to a blind person. And so you could say potentially you might enjoy it. And while a lot of people do go onto a Ferris wheel to see the view, there are lots of other things that might be worthwhile doing. So it might be you want to go just to say that you've done it, kind of tick it off. It might be something new to try. You might want to go for the ambience, for the experience. You might want to go to do something with family, with friends, something like that. So answer it in an empathetic way. Acknowledge the fact that a lot of people might go for the view, but that it's also possible to go for something like the experience or to go with friends and to try and relate it back to the context of someone who is blind. And importantly, they're blind since birth. So does that make
Okay.
sense?
Yes, that makes sense. Thank you for your feedback.
Very welcome. So great work again. Really brave of you. Just remember, what is the selection criteria? Empathy, communication. How are you demonstrating that? Right. We've got now a mix between a question that is both medicine relevant and dentistry relevant. If it's a dental interview, they'll probably ask about dental decay. If it's a medicine question, they'll probably ask about obesity crisis. But either way, the question we have is a sugar tax an appropriate solution to the problems of pediatric health? And so, do we have any volunteers? Do you think that the sugar tax is a good solution to the problem of pediatric health? So, do we have any volunteers, either medical or dental? So, all three volunteers have answered a question already. Would anyone else like to give it a go? Let's have, yeah, Athmika, let's have you.
So I'm going to talk about it through a dentistry perspective. So I think that there are both negatives and positives to applying a sugar tax. I think, for example, one of the biggest positives would be the decrease in dental decay cases, as recently I've been reading around on the news, and quite a lot of the cases admitted into hospital is dental decay. And obviously, this is taking up a lot of the NHS's time and resources. And a sugar tax could be a way of, could be preventative care to actually reduce the amount of dental decay cases. However, there could be a negative side to this. I think the sugar tax might be demonizing like actually having sweets, and we don't want to create this fear among people so that they're like absolutely scared of dental decay, because it is not, it is something that can be treated with different resources that we have.
Brilliant. And what do you think about kind of the mechanism of the tax? So you're charging more money. Do you think that's necessarily a fair tax? Is it the same on everyone, or are some people perhaps affected by this more?
I think definitely because of the rising poverty that we're seeing in the UK, I think it definitely affects a lot of the people who are less well off. And I don't think that's completely fair, because NHS, they want everybody to have equal access to like the NHS and their resources.
That makes sense. And I mean, it's not necessarily directly linked to NHS resources, as it's more about access to sugary foods and drinks. But it would definitely be a matter of kind of, is this a tax that's fair when you're affecting one group of people, the low income, a lot more than others? That would be a very good point too.
Oh, I
So I
see.
think that's a great answer, especially when you talked about preventative. Really good to talk about that. Saving money, that's really good as well. So prevention is saving money. And you talked about how demonizing unhealthy food is not a good idea. It's a lot better about moderation. So to encourage people to make changes in moderation, I would use words like empowerment and education. So encourage patients to exercise their autonomy, to make decisions for themselves, choose healthier options. It's not a good idea to force this onto someone by charging them more. It might be a good idea to provide them with the education to make healthier choices. But also, you can think about the other side of things. So rather than making food more expensive, is there any way that we could subsidize more healthy foods? And we know that there are sort of ongoing problems with people on low incomes, perhaps not being able to afford as healthy a diet. So we could discuss the possibility of perhaps we could make healthier food subsidized or provide access to healthier food in a form of what's called social prescribing. So kind of prescribing social means to try and improve people's health. And so you could discuss alternatives. But I think one really important thing here is you should have that hot topics background knowledge, especially as a dental applicant, not at this stage, but by the time you get to your interviews, which is that we've done the sugar tax in the past. And what we can say is that since we've introduced the sugar tax in the UK, we've actually got a reduction in cases of obesity, a reduction in cases of teeth rotting. So, from that perspective, you could say it's definitely, at least to some extent, a success. And one of the reasons why is because, as we can see, the companies, they have actually reduced the sugar in the drinks to try and avoid the tax. So rather than people making healthier choices, you could also talk about how it encourages companies to make better choices and to improve the recipe so that they can avoid the tax. But in terms of how I would answer this, I would start with an introduction talking about how it already exists, show you that background knowledge and wider reading, and talk about how it has been effective in some ways, that people are less likely to have cavities, less likely to have obesity because of this tax. Talk about kind of the idea of patient autonomy, so encouraging patients to make choices for themselves, and talk about how if you encourage them to do that, that's going to have a more lasting impact. Whereas this is only kind of based on people's wallet, not necessarily changing people's thoughts. It might be an unfair burden on low income families. So you could think about the idea of justice. But you can talk about pros in terms of for the level of the corporation and how we've encouraged companies to make better decisions. So you want to come to some kind of conclusion. And so your conclusion should be quite balanced. You might want to say that in the short term, it's been pretty good, but it's not necessarily the best thing we do in the long term. So in the long term, we could perhaps use the money from this tax to promote education, access to exercise, nutritious diet, healthy lifestyles. So all that sort of thing. And also think about the fact that this tax is only on sugary drinks. When we talk about the sugar tax that's currently in place, and how kind of there are other contributors to health too. So you can have other kinds of sugary food, but also you can have other things that are not good for a person's health beyond just quantity of sugar. And so we've got some of the options here. You can change the price, but you can also change the kind of options people have. You can also focus on people. You can raise awareness. So lots of things you can do. Let's see. We'll do one last question before we move on to more Oxford-oriented stuff. So this is a situational judgment question. Now, you are an oncologist in a tertiary center, and a patient you've been seeing for 10 months, they've recently entered remission. So someone in the chat, what do you think remission means? Cancer-free. Yep, the cancer's completely gone away. But if you had an interview question like this and you weren't sure what it meant, I would just ask first. So if you weren't sure, what do you mean by remission? Well, remission means the cancer has kind of fully gone away, it's regressed. Now, imagine you know what that means, you understand the question, they've given you a luxury watch of several £100s. How do you respond to this scenario? So, any volunteers? Ibrahim, let's give this a go.
Well, according to like GMC guidelines, it's not unethical for doctors to accept gifts from their patients because it might lead to them treating other patients, them prioritizing certain patients over other patients because of like gifts and stuff like that. And it detracts from the professional relationship that a doctor has with the patient. So I think the best thing to do in this scenario would just be to respectfully decline, or yeah, I think that's probably the best option.
Okay, brilliant. The points here are good. Just think a little bit more about how you're going to develop them. So, for example, you're respectfully declining. How are you going to do that? So you're going to do that sensitively. You're going to explain that you're very thankful for the gift, but you're going to say that as per the rules and guidelines, we're unfortunately not able to accept this gift. And then you can say, perhaps as an alternative, we could suggest that you make a donation to the hospital charity. And that might be a way of accepting and acknowledging their feelings. So don't just say no, make sure you're doing it sensitively. And even if you would do that in real life, make sure you're explaining that you would do that to the interviewer. Now, the GMC guidelines, not quite. The GMC guidelines don't just say you can't take any gift, they talk about high value gifts. But we'll come to that in a second. You also want to think about how you introduce this question. So you want to start by saying that kind of this is quite a complex scenario because we're facing two competing challenges. One is that we want to avoid kind of any kind of partiality, any sort of image of corruption. But at the same time, we want to make sure that we keep the patient happy. And it's very understandable that this patient wants to give a gift, given that they've been seeing them for the last 10 months, you have an established relationship, and it's really important that whatever you do, you maintain that doctor-patient relationship. So start by talking about that background and why this situation is challenging. Then go on to discuss GMC guidelines, and then go on to discuss kind of the pros and cons of accepting or not accepting the gift. So in that sense, it was reasonably good. But if you are going to refer to GMC guidelines, what they specifically would say in good medical practice is that you can't accept any gifts that might affect or be seen to affect the way that you propose or prescribe treatments. So let's put in the chat, what do we think? If someone was to give a card and a box of chocolates, would that be okay? Yeah. So the problem is not necessarily accepting a gift. The problem is accepting a gift that can affect how you behave, but also, and I think this is really important to mention, a gift that can be seen to affect how you behave. So even if you treat patients fairly after they give you a gift, it might be that the patient feels like they're being treated better just because they've given the gift. So from their perspective, even if you're doing the right thing, it might be seen to affect the way that you provide treatment. And other people, like other doctors in the team, they might see it as if you're proposing treatment in a different way. So you're not going to accept. And Huda, that answers your question. If you accept it and you don't let it affect anything, that's still not appropriate because it could be seen to affect the way you propose treatment. The patient, if you're very nice to them the next day, they might think that you're only being nice to them because you gave them a gift, because you got a gift. So any gift that is of such a value that you or someone else might perceive it to be affecting the way you behave, that is what GMC guidelines say you shouldn't accept. And that's what you want to address. So in your interview answer, start by giving that background, talking about the challenge of competing demands. You don't want to accept it because it's high value, it's not appropriate, but you want to acknowledge the patient's gesture. Now you're going to say how you would not personally, obviously, let that change your practice, but even so, it's not the right thing to do. It shouldn't be seen to affect anything. I would also make sure you talk about the multidisciplinary team. So if you're an oncologist, make sure you say it's obviously not just me who's been treating you. It wouldn't be fair if I was to just take the gift because there are many other people in the hospital who've also been involved. Now, there's not one fixed amount of how much money is too much for this kind of question. It really depends on the scenario. So, for example, something might be appropriate when it's kind of coming after an established relationship. So, if, for example, you've been seeing your oncologist for the last 10 months and you bring them a really nice box of chocolates and you give them that after an established relationship and it's worth like 20, 30, 40 pounds, that might be okay. But if you're going to A&E and you bring that gift and you take it to the reception and you give them that box of chocolates and you say, can I jump the queue? Then clearly you can see that that's not appropriate. So it's very much situationally dependent. And it might depend on stuff like how long you've known the patient for, what is the scenario over which they give the gift. But as a rough guideline, we know that the British Medical Association, they say that you should keep a record of any gift over £100. And so that would be the kind of price range where it's inappropriate, where it would be seen to affect your practice. And so something like a £500 watch would definitely not be okay. And if there was a question like this at interview, it'll be quite obvious whether or not you're supposed to take the gift. So like this one, clearly you don't. Definitely do explain why you can't take it, thank them for the gesture, suggest an alternative, And if you're not sure what to do, it might be a good idea to discuss with other members of the team.
Huh?
So does that make sense how you approach this?